Good morning, everybody. We have Alex here with us, and he's been willing to share his information about his case, which is I'm very thankful for, because this information can help a lot of people at home. In this particular case, we're talking about herniated disc. Herniated disc, first let's describe what a disc is. Here's an example of a spine. In the low back, you have 5 bones that make up the spine, 5, 4, 3, 2, 1. In the mid back, you have 12, and in the neck, you have 7 bones. But between those bones, you have these discs. Discs are a very hard cartilaginous substance that basically provides cushion between the spine. If you notice here, these discs have the same shape as the bones that they're in between. But even more importantly, what's behind the disc are the nerves that leave out of the spine. So the discs themselves are probably the most commonly thing damaging the spine if we have a problem. So I like to use the term, when we say herniated disc, the best way to understand it is understand what a hernia is. You know, medical terminology, you can use big words for a lot of different things, but when you know a hernia, you're thinking about the inside gut basically coming outside the muscle, herniating out. It's a hernia coming out. So a disc herniation is about the same thing. There's 2 parts of the disc. The inside, which is very soft, the outside which is very hard, and when the outside becomes damaged, the inside can start pushing out, and the problem is it can press on the spinal nerve. And when you have any pressure on the spinal nerve, depending on where that spinal nerve goes, you can have extra pain, ridiculous symptoms, numbness, tingling, that type of thing, and generally just pain. So when we're dealing with a herniated disc, we have to really think about how to take pressure off the disc without damaging it further while it's healing. And that's actually what we're doing with Alex. So a lot of part of what you'll see us doing today is stretching. We will be doing adjusting to put the spine in a better position so that there's less pressure on the disc. But when we're dealing with disc, and actually Alex is a great, he's an athlete, he takes care of himself very well. So he's a great example of a patient who would have not had a problem if not for some form of trauma, like a fall. Most patients that we see who are dealing with disc herniations, usually some form of trauma, an automobile accident, some type of fall. But actually disc herniations happen with a lot of people, just general wear and tear of the disc. Standing, walking, previous history with sports can cause disc damage. But the most important thing to know when you're dealing with disc herniation is that you've got to give yourself time. Because while Alex is an athlete and he's in really good shape, if we go out too soon and start jogging again, we start running again, that disc doesn't have the time to heal, and it can progressively develop scar tissue and get worse. So from a treatment standpoint, we want to engage the core to make it stronger, because that's what stabilizes the disc. We want to make sure we keep the muscles flexible, because if the muscles are tight, it's going to change the position of our pelvis. For instance, if the hamstring muscles attached down to this bone, if they're tight, it's going to roll our pelvis back this way, creating the spine to be more straight and putting more vertical pressure along the disc. So we need to keep our hamstring muscles flexible, even our quad muscles. We need to keep our core strong, and we need to keep the spine loose. That's where the adjustment comes in, and that's what we'll be doing today. So thanks again, Alex, for being someone that can give out information to the patients in the world out there. If you have pain in the back, if you think you have a disc herniation, we're here at Goldson Spine. We deal with this a lot, and we want to help you get well. We want to encourage you to take care of yourself. We want to encourage you to make sure you need to do what you need to do at home to maintain a level of health. And we just want to make sure you're not walking around with pain. So look forward to seeing you. Peace. A lot of times patients who have low back pain, I'm still adjusting their neck. And the question is why? If you have low back pain, why am I adjusting the neck? A lot of times you have compensation that takes place all over the body. So while you have tightness in your whole back, your low back, you may still be compensating, which can create tension in the mid back and definitely within the neck. Because you're moving differently, you're spending energy differently. So the whole spine can get locked up. Let it go, let it go, let it go. You're right here, don't move, okay? Not every adjustment is going to come with the audible. Can you take that out of your pocket for me, Alex? Not every adjustment is going to come with the audible and like the big crack. Some will, some won't. It's the type of sound is really what I'm looking for. Means that things were stuck. Sometimes I hear means that the joints themselves are a little bit more degenerated and they're not adjusting across their line very well. But when I hear like that means there's muscle restriction, that means there's probably joint misalignment, but it doesn't necessarily mean there's degeneration going on. So I listen to the type of sound that's coming out as opposed to just how much sound is being made. Just relax right there. Thank you very much. Relax this. Gotcha, gotcha. Good. Different, totally different than the other side. Come on up. Again, thanks Alex for being able to being willing to demonstrate what's going on with him with herniated disc. If you're dealing with herniated disc at home, don't let it stick around too long. You get muscle stiffness, you get low back pain, you get even more discomfort and pain. When you can really just come in and get stretched, we can adjust you and we can show you what you need to do at home. See you guys later.